Measles is a very contagious disease caused by a virus, the measles virus, or transmitted through release of these viruses from an infected person through coughing or sneezing, or through contact with saliva and discharges of the nose from the infected patient.
Extremely contagious and a serious disease. It is transferred by coughing, sneezing, or even close personal contact.
Why it is highly contagious? Because if you stay in a room together with the infected person, you can highly get the virus through that way by sneezing or coughing of the infected patient. Since it is airborne, so any corners of the room may harbor all those viruses released from the infected patient.
Next, for our healthcare workers, the proper defense that we can have is to perform proper hand hygiene before and after patient contact and the usage of our personal protective equipment. We should wear N95 if we are in closed space with a person who has measles.
If the person is not immune to measles, that is an opportunity for that person to acquire that viruses.
So who is at risk of measles? Unvaccinated young children have the highest risk of measles. Unvaccinated pregnant women also have high risk, and generally any non-immune person can become infected of measles.
So what are the symptoms of measles? First, the incubation period is 7 to 12 days from the time this virus is acquired, and then the symptoms may develop after 10 to 12 days. But the first symptoms would be fever, high-grade fever. But before the fever appears, or at the beginning of the fever, there might be some, there can be some feature of measles, which is oftenly missed by even the physicians. These are called the complex spots, because if the complex spots has been recognized, then the diagnosis is almost 100% the measles, because only measles are known to produce the complex spots. So the fever may be high grade. It appears in one to 3 days. It may develop into progressive temperatures, higher temperatures, and then at that particular time, when the fever is about 2 to 3 days already, the rashes disappear. The rashes are flat and reddish. It may appear on the face, in the hairlines, and then it may go down into the neck, then the trunk, the arms, and the legs. While the rashes are appearing, the temperature is getting high further. So when the rashes now are going down into the legs, the rashes in the upper part of the body start to resolve, and the fever may start also to disappear. Other symptoms like cough, dry cough with sore throat, and it may have, we may encounter coryza, which is a syndrome of runny nose and conjunctivitis or sore eyes. It may also develop into diarrhea and other several body pains for this measles. Please have yourself vaccinated for measles.
Getting vaccinated is the best way to protect yourself, your family, and your community.